Hello, everyone. My name is Angela Fields. I'm a community health worker. I am also the Associate Executive Director with the Minnesota Community Health Worker Alliance. And welcome to the July 10th, 2024 CHW Learning Circle. We'll start off today. We'll give you an overview of the Learning Circle and our purpose and our mission and guiding principles. The CHW Learning Circle, the Minnesota Community Health Worker Alliance, also known as the Alliance or Mentora Learning Circle, is a peer learning circle meeting that's held the first Wednesday of each month, unless it's a holiday month, then it'll go to divert to the second Wednesday of the week. And it's held from 3 to 4:30 p.m. remotely. It is open to all CHWs and it's free of charge by the Minnesota Community Health Worker Alliance. The mission of the CHW Learning Circle is to provide an avenue for CHWs to connect, learn, and tap into one another's knowledge through discussion. The Mentor Learning Circle is hosted by the Alliance, which lays out the platform of clear organizational goals and objectives for the advancement of all those in the CHW profession. The vision of the circle is to create a workforce that encompasses the voices of those in the CHW profession and support our vision of nothing about us without us. The purpose of the CHW monthly capacity building event for CHWs is facilitated by CHWs. At the circle, CHWs learn with their peers and explore issues in their field. The circle provides an avenue in which CHWs can share successes, concerns, and gain perspectives of their peers. CHWs work in multiple environments, as we know, and we enjoy getting together and learning with each other. And because we all may work in different work settings. So we have guest speakers and experts provide training in an informal and formal capacity on current issues in the healthcare and the social services field. Our guiding principles also supports our vision of nothing about us without us. The leadership of the Learning Circle is myself, Angela Fields. As I mentioned, I'm the Associate Executive Director of the Learning Circle. I plan, manage, and facilitate the Learning Circle and try in hopes to create a peer-to-peer educational environment. We understand our objectives is that we understand that each organization faces unique challenges, which is why our discussion sessions focus on the core needs of the CHWs and what we need to be successful in our individual roles. We explore strategies to increase the effectiveness of CHWs. We provide knowledge around the impact of health and examine the ethnical concerns inherited in our CHW roles. And so the circle content explores topics such as our scope of practice and various roles CHWs can play in an organization or team. We talk about core professional skills and the CHW character development through training. We also have workforce development and engagement options that we discuss. We talk about health trends and health topics. We provide health education and health techniques for various populations through our CHWs. And so today for our July 10th Learning Circle, we invite Juniper, a program of Trellis, in today to provide us with a presentation. But before we start that, I would like to ask if we are recording this session. Please feel free to be on or off camera, but if you can come on for a few moments at the beginning and do your introduction, we would love to see your lovely faces. And so we would like to start out with asking you to introduce yourself, give your first and last name, your location, your position or title, and share a little bit about what you enjoy about being a CHW. For myself, as an example, my name is Angela Fields, and I'm a community health worker, certificate holder since 2008. I'm known for my various work across health and social systems, and also my executive leadership in the field. I gain from what I love about being a CHW is I gain a sense of purpose, I'm making a difference. I love advocating and empowering individuals and communities, as well as relationship builders, because I'm a connector. And so I'm going to pass it along to Carrie.
Hi there, I'm Carrie Harris. I work with Volunteers America. I am a program manager. I do hold a CHW certificate. So I supervise some staff and community health workers and also social workers. And we work in low income housing in Minneapolis. And what I love about being a CHW is I love working with people, and I like helping people make their health goals and realizing that they can make a difference and that it doesn't have to be the way it is.
Absolutely. Thank you for sharing. Mai, would you like to come off camera and share with us? Just share with us your name, your title, your location, and what you love about being a CHW.
Hello all, I apologize for not coming on camera. I'm not feeling my best.
Oh, we understand.
I am a CHW. I am also a supervisor with our outreach program on the Mentor and SNAP team. I work at North Point, located in North Minneapolis, and I'm here happy to be here today.
Thank you for your introduction and for sharing your mission with us. Stacy.
Hi, I'm Stacy Dunn, and I work with our community-based providers at Juniper. And I love being in this space where we're sort of integrating social care and healthcare. I'm just excited about that every single day. So, and I'm 7/8 of a community health worker. I'll finish the community health worker program in August. So,
Oh, you're right there. Well, congratulations if we don't speak again, but hopefully that we do. Welcome to the health equity workforce. We are each other's keepers. And Roxanne, feel comfortable to come off camera if you like. If not, you can stay off camera. There you go. And tell us, introduce yourself, tell us your location and your connection to the CHW workforce.
All right. So my name is Roxanne Hanga, and I help with the internship and a little bit of some of the other pieces of the classes through Minnesota West. I'm also in the customized training department, so I work a lot with employers that are looking to employ CHWs. And you can see this lovely little sling that I'm in. I was doing my sister's e-bike and getting a little ambitious on the speed and hit some sand and hit a curb and broke my collarbone. So
Wow.
It is what it is. Yep.
Such a trooper, and you're here and you're smiling and you're upright. Oh my gosh, you are the epitome. You must, but that takes health. That takes health and the quality of health. So when you sustain something like that, you can manage better in that space. Absolutely. You're my inspiration. Definitely.
Yeah, next time don't drive so fast.
Don't drive so fast.
And I'm like, okay, I better buy a helmet because it could have been really bad. So.
Absolutely. And we have a big conference coming up. So you definitely got a lot underway. So we're here for you. Just want to let you know. We are definitely here for you. And so without further ado, we're going to shift into our topic of the day. And I would like to introduce Juniper. And Juniper, through a network of Minnesota community-based organizations, delivers evidence-based health promotion programs designed to prevent and manage chronic diseases, improve physical activities, and enhance quality of life. Juniper is a program of Trellis, is a Minnesota Community Care Hub, CCH. Trellis is a nonprofit organization based in the Twin Cities metro area and serves as a designated area agency on aging. Through Juniper, Trellis extends its reach to serve the entire state of Minnesota, connecting adults with healthy promotion and chronic disease self-management programs by linking community organizations, healthcare providers, public health organizations, insurers. Juniper helps older Minnesotans bridge the gap between medical and social care. The CCH supports class leaders, instructors, community health workers, enable them to provide culturally competent health education and support. CHWs play a critical role in connecting healthcare providers with the community. Stacy Dunn is here with us today, is a Juniper Provider Relations Coordinator. She will present an overview of the program and its initiatives. Currently, Stacy is obtaining her CHW credentials at St. Catherine's University. Thank you for joining us to learn how the Juniper programs, with the support of the Community Care Hub and CHWs, are enhancing community health and wellness. So I will turn this portion of the presentation over to you, Stacy.
Thank you. Thank you. Well, this is a lovely group, and I know that a couple of you, or more than a couple, are already familiar with Juniper programs. And I'm hoping if you think of Juniper programs as sort of our classes and our evidence-based workshops, that you might come away after the end of today with a little bit different thought about who we are. So anyway, thank you. I've been in public health on and off for over 30 years. So this space is a space that I'm so happy to be sort of in that last stage of my career in, because it brings together health equity, it brings together prevention-based services, working on social determinants of health, and wraps it up in a package that is sustainable for people. So I'm just thrilled about all of this, and I hope that you are too. I'm going to start my slideshow here.
Absolutely.
All righty. So what we're going to talk about today, we'll divide this into sections. We'll talk about Juniper and Trellis, who they are, what a community care hub is, and what the potential of a community care hub is. We'll talk about our evidence-based programs and what kind of incredible impacts they've had, and talk about the role of community health workers. I think there are such parallel tracks that community health workers and the community care hub run down that's an exciting piece for me. And then how you might want to get involved with Juniper or Trellis at the end. So we'll start off. I think you might be a little familiar with this, but Trellis is the area agency on aging for the 7-county metro area. The area agencies on aging are good aggregators and supporters for community-based organizations that work with populations of older adults. We also manage the partnership for the Juniper network, which is a statewide network. And then we have in 4 states, we have other people who are using this database that we've put together with the Community Care Hub. You might know us through our senior linkage line. If you work with older adults, that's always a great place to start. Or you might know us through pension rights. Our pension rights services are in 7 states right now. So depending on the program, we can have a little different reach. All right, so Juniper is a program of Trellis, and it is one of 58 nationally recognized community care hubs in the country. And the people that have recognized this community care hub model is the Administration for Community Living, ACL. We probably all have heard of that. So that is a designation that means that we are a community-focused entity that organizes and supports this big network of community-based organizations to address health-related social needs. So we aren't the provider usually of service. It's our community-based organizations that are closest to local communities, that are in those communities that are providing the service. And one of the things that we're doing is looking at how we can help that system be sustainable. So how do we bring money into social care to make those programs last in the long term? It used to be that social care was here in a silo and healthcare was here in a silo. And it is really exciting with community health workers and also with this community care hub that that's now actually an integrated system. I remember 30 years ago when I first was working, I was invited back to a panel from where I got my master's at, and I was on the panel because I was considered a non-traditional worker in public health. And I remember even then I worked at that time with an umbrella organization that had a food shelf. We did a lot of violence prevention work. We'd had emergency housing. We had family loan programs. And I remember thinking then, I don't know how much more public healthy you can get than being in that position, but that is how much things have changed. It used to be that those people in healthcare and those people in social services were very separate. So now that there's an integration of those services, it's just really exciting to be part of that. So ACL has looked to this community care hub model, as have some other people recently. We've been in this for quite a long time, but all of a sudden it feels like we're flavor of the month. A lot of people have started to talk about us. This model is a model that CDC has looked to. It's also a model that President Biden came out with sort of his blueprint for how we were going to address social determinants of health. And this was sort of the pathway that was decided on there. So a lot of people are talking about community care hubs, and what community care hubs allow community-based organizations to do is to access the hub as the person who provides billing and relationships with health plans, so that those healthcare dollars can then be billed through a central billing organization and then dispersed to the community-based organizations. And we'll talk a little bit further about how that actually adds a lot of equity into the system and all those implications. So we have all those trusted relationships. It also allows us to sort of work better together as a hub and have some sustainability in the system. So we don't have smaller organizations who couldn't have the internal capacity to do all that billing themselves. It gives them a little bit of power and a little bit of support for being able to be able to price our classes what it actually costs to provide a service, and advocate for getting reimbursed for what we actually know is a true cost of service. So there's some strength in numbers for us. And right now, this community care hub model is used we started because we're the area agency on aging in with the population of older adults, but that is where we started, and you can kind of see why a lot of the community care hubs around the nation are with area agencies on aging, and there's a few reasons for that. One of which is when I talked about earlier, we're sort of naturally already in the role of aggregating with community-based organizations and acting as a supporter of those organizations. And so it's sort of a natural fit for those area agencies on aging. But the services, or a community care hub, doesn't have to serve only the aging population. This is a model with that sort of centralized billing function, with health plans that could be applied to different populations. And we started this service with evidence-based programming, but you'll hear a little bit later, we certainly have always planned on that programming to go beyond, really to go beyond evidence-based programming, and to include things that address social determinants of health, like potentially transportation services or food services. So there's quite an array of things that we could use a community care hub to transfer some of that health plan reimbursement into social service organizations that are actually having a really huge effect on people's health. We talked about how community care hubs might influence equity. And that is a really fun thing to think about. As we think about the environment that we're in right now, we know that our cost of service is growing and growing. The cost of workers has increased, inflation is there. In aging services, we know there are more and more people who are likely to need our services. And we also know that the funding from certain sources is decreasing. So we know that grant funding, there's a lot more competition for those grants. We know that charitable giving is down. And so the funding climate is tighter, and we're all facing greater and greater needs. So this ability to work together as a group so that community-based organizations can braid some of their grant funding, their donor contributions with maybe some health plan reimbursement means that we might be able to have a more sustainable system over time. And we do talk a lot about economics and sustainability, and that's because we know that a program isn't able to continue unless there is a financial basis for it to continue. So, so that's why we talk so much about where the funding is going to come from. Our network, this is a map of our network, and we are offering classes right now in 8 different languages, which I think is pretty impressive for our little network here. Over half, or about half, of our participants are coming from rural areas. We know that sometimes is a harder population to reach, so that's doing a lot towards health equity too. And we have 2 community health workers on staff, and we'll talk about what they do and what their roles are a little bit later. And then we have about 45 roughly community-based organizations that are part of our network. And about 10 of those offer diabetes prevention programs. So, and then the rest offer our falls prevention, our chronic disease management in those classes. All right, so any questions from anybody about Community Care Hub before we sort of move into the area of our evidence-based programs and what impacts they have? No? Okay. All right. So I'm going to give a little bit of a description about some of our what a typical participant for us would be. So In Minnesota, we have about 22% of our population is overweight or obese. We have 67% that have dementia. And we also know that about 80% of older adults have at least one chronic condition. So there is a lot of space where education, behavior-based programs can have a really big impact in prevention. And each year, 1 in 3 older adults has a fall. That costs the state of Minnesota $700 million. And this is an older number. So you can imagine with the baby boomers starting to enter that older adult category, that that's rapidly increasing in costs. It is the leading cause of injury death, not the leading cause of death, but the leading cause of injury death if you're a Minnesotan who's age 65 or older. Minnesota has a huge number of older adults that fall compared to other states. And people often think it's the ice, and it's what I have heard is that it's not necessarily the ice, it's the inactivity that can happen because of weather during winter months. So health, we know, and you know this, is more than clinical care. So when we look at this pie chart, we see that about 10% of our health outcomes come from clinical care. And then we have 30% from health behaviors, and that is definitely part of the population that we're trying to reach. And then social and economic factors account for 40% of health outcomes, physical environment 10%, and genes and biology 10%. So that 80% that's not clinical care and genes and biology, we're hoping to address. When we talk internally, of course, we talk about social determinants of health, which is what all good community health workers love to talk about, because those are those factors that influence health even more than clinical care. And then we also talk about those whole health-related social needs. And the way we sort of distinguish it is that those social determinants of health are sort of the bigger factors that are those population level factors that are influencing health. And when we tend to talk internally about health related social needs, we tend to use that more for those individual factors. So that trickle down effect of the social determinants of health onto the individual person. All right. So our classes are in some of the big categories here. This out of the way. So we have living well classes. So that helps people know how to manage chronic conditions. And we saw on the slide before about how many people have more than one chronic condition. So there's sort of live well with chronic conditions. Anybody with a chronic condition can take, and then we have those specialties in there for living well with chronic pain and living well with diabetes. We have what feels like more traditional exercise programs with Walk with Ease, which is through the Arthritis Foundation, Stay Active and Independent for Life, and the Arthritis Foundation exercise program. We have classes related to preventing falls. So that's matter of balance, Tai Chi Chuan, moving for better balance. It's a very specific type of Tai Chi, and stepping on. We'll give you a little more detail about these classes. So with our Living Well programs, they're usually 6 weeks, and they meet for 2.5 hours every week. And you're gonna kind of love the format of the classes because it dovetails perfectly with a community health worker's role. We're talking really holistically about what it takes to live with a chronic disease. So we're talking about pain management, nutrition, exercise, medication, the emotions that come with dealing with a chronic disease, and communicating with doctors. And these classes we have virtually, we have in person, and we have by phone. And the beauty of the Juniper classes is that they always have space for that peer support. So I know our Surgeon General right now, Dr. Vivek Murthy, he is like a big advocate of social isolation does have health effects. And so a good participant for these classes are sometimes somebody who maybe is experiencing a little bit of that social isolation, because that is like part and parcel of every class that we give. So, whoops, go too fast sometimes. So in our Living Well with Chronic Conditions class, we really do talk about having that plan. It's a lot of sort of that goal setting that you might have done in motivational interviewing, where we're talking about setting a goal, having it wrapped in a time frame, and also making sure that it's something that is motivating to the person who's having to make the behavior change, that it's not, oh, what do other people like my family or my doctor, what do they say I have to do? So, so it's definitely person driven and individual driven in the classes. Our diabetes prevention program is a really fascinating program. It lasts for a year. It's a lifestyle program. So when people join up, they are getting a community of support from other people who are trying to also make some lifestyle changes. The target audience for this are people who have pre-diabetes. So people who are 18 plus, people who have a BMI of 25 or higher for most populations. They shouldn't currently have diabetes and not be pregnant and not have end-stage renal disease, and have a blood test in the pre-diabetes range in the last 12 months, or have had a diagnosis of gestational diabetes. The goals of the program are, to me, just fascinating because they're small changes. So sometimes it can feel a little bit overwhelming to think that you actually behaviorally can reduce your risk of prediabetes. So this program is as effective as metformin in being able to delay onset or control blood sugars if you are a completer. So the goal for the individuals are to lose about 5 to 10% of body weight. So over a year, that's very achievable. If you think of somebody who is 150 pounds, 10% is 15 pounds. So that's a very, very achievable goal. At 5%, even more achievable, about 7.5 pounds. The activity level that we're looking for is about 150 minutes of exercise per week. And the program is set up so that you meet once a week in the beginning, and then as the year goes on, then you're only checking in once a month. We know that behavior change is really hard to do, and so that gives you the support for when you're doing great, but also maybe 6 months in, all of a sudden you've plateaued with your weight loss and it may start to feel discouraging. And that's when we give you the support to get the rest of the way through. All right. We're going to talk a little bit about who you might be meeting in the community who might be a good fit for our classes. So these two gals here lost 146 pounds combined. They started with Gail on the left there. She had pre-diabetes, but she also had trouble with her blood pressure. So we talk about comorbidities, and we know that risk factors for pre-diabetes are the same risk factors for cardiovascular disease and on and on. So she had those multiple chronic diseases coming in. Phyllis on the right, she ate really well, but her serving sizes were too big probably for what she needed. So with a combination of modifying, doing those sensible modifications that you can keep up for the rest of your life, Gail on the left was able to lose 70 pounds, and Phyllis on the right was able to lose 76 pounds. So, small, really small changes with the diabetes prevention program can have really big outcomes. This is our Tai Chi Guang class, and I think some of our most exciting news that we've had in the past year has been that something that we have suspected, this class can reduce your fall risk pretty dramatically, but it also has been shown to have some cognitive benefits for our older adults too. So that's very exciting to have sort of that dual benefit with our Tai Chi class. Tai Chi focuses on those mini therapeutic movements. It's muscles that you tend to use every day. For example, a functional thing that it'll address is getting up from a chair. I have a really good participant story that just makes me smile every time I think of it, but we had one of our class participants who ended up in the hospital with another condition, and her occupational therapist came in and she was saying to her, okay, now, you've spent some time in bed and we're gonna work on strength, and I'm gonna show you today how, we're gonna work on getting up out of bed. And she said, oh, I learned this in Tai Chi, and it's a 3-step process, and I'm gonna scoot to the end of my bed, and I'm gonna, so she, so the OT was really interested in the program based on really what she knew and what she was bringing forward from this class. And we have lots of stories that come back about people who, because you're shifting your weight and you're really learning how to shift that core, the people who say, I was starting to fall, and then that movement came to me, that muscle memory kicked in, and I was able to stop a fall. So it's a pretty gratifying class. Our SAIL class, Stay Active and Independent for Life, is our closest class to sort of a traditional exercise program. People meet for two or three times a week for 1 hour. This can be accommodated to somebody who maybe has a little bit more, needs more assistance in walking, or has a little bit of a balance, a need to have exercise modified because of balance issues. So you can see that this follows a typical exercise class. There's warm up, get your heart rate up, work on your balance and strength a little bit. All right, and we've done a lot of measuring in the last couple of years about how effective our classes are. And we do know that we are making a pretty large difference in people's lives. At least 73% of our participants who were in a falls prevention class took at least two steps to reduce their fall risk. So before I got involved in these classes, I really believed that it was all about exercise, but there are a lot of other things that contribute to falls, like thinking about if you've had a medication review, have you had your vision checked? Do you have those throw rugs all over your house? So there's all kinds of things that can help reduce that fall risk. The chronic disease self-management class, I think these numbers are pretty astronomical. 95% say they're eating healthier, 93% are increasing their physical activity. So we know that no matter what chronic condition you have, those are all going to be good things to help in that management. 90% of the people who come through our classes say that they would take another Juniper class, and 96% would recommend these classes to a friend. We know that the trainers that we have who actually lead these trainers are really high quality. I think the attributes that make somebody a good community health worker also tend to make somebody a really good class leader, somebody who's really interested in the individual and what it is that that person might need in a class, and how to make people feel welcome, how to promote a community feeling in the class so that people feel comfortable coming in wherever it is that they're at physically. So that's a perfect combination. These are some of the comments that we have from some of our participants. This person says that they used a cane for the last few years, and after Tai Chi, they no longer need it. People in the class became their friends. They never felt judged. And the workshop helped me understand that I'm not alone. I think with a lot of people, that's really important to know that other people are there in the same boat as you. We have a beautiful story that we put in our Flourish sort of online. We send that out once a week to past participants in our classes. And we had a class participant who just told a beautiful story about having been a caregiver for her partner who passed away. And it really, that time after really sort of derailed her a little bit. She was in a community where she didn't really feel a part of it. And she called to become involved in one of the classes, and the leader welcomed her in and said, "Now, how are you going to get here?" And made sure that everything she needed to be able to participate in this class was really taken care of for her. And she came to the class, and she ended up, for personal reasons, had to miss a few classes. And when she missed the class, the other participants checked in on her to see, you know, where she was and make sure that she was coming back and that she was doing okay. And she really describes that class as life-changing, that it was a place where she was able to kind of ease her way back into those social situations after being apart from them for a little while. So the socialization makes a difference. Juniper classes, if you have people that you know that have been diagnosed with prediabetes, with diabetes, arthritis, high blood pressure, heart disease, depression, anxiety, or any other chronic condition, they have chronic pain, if they're at an increased risk for falls, or would just benefit from that greater social connection. These are all great partners for who you can refer into our classes. All right. This is a really, I love this picture. I love that smile on his face. So Sue is one of our community health workers, and he really came at a powerful time in one of our buildings in public housing. It was after things started opening up after COVID. And so we know if you were an older adult during COVID, there was an increase likelihood that you might have become a little more isolated than what you were before COVID. He also was in a building that had another pretty typical response in that the number of services that were being offered post-COVID was different than what was being offered pre-COVID. And so he partnered up with some people in the building to introduce him around, to start offering as a way to introduce himself some of our evidence-based classes. And he found that he was doing a lot of translation between the building management and the community that was there. He was finding that sometimes the building management wasn't always understanding maybe culturally why people were doing some of the things that they were doing, or they might have needs that the building management, by just doing something in a different way, could meet. He also managed to connect with somebody who it really had got caught in that time where the services got caught in that change in services that happened during COVID. So the mental health supports that they were getting pre-COVID, all of a sudden they weren't getting those mental health supports anymore. The chore services that they were getting, they weren't getting. The congregate dining, they weren't getting. And it, you know what that can do if you have a couple of those stressors happening at the same time. It'll really affect your health. And they were able to sort of get together and make a plan, doing a lot of that beautiful motivational interviewing that we do as community health workers, and do some social determinants of health screening, and was able to connect up with some mental health supports and also some of those chore service supports, and just how that person just was able to start showing up to things in the community, and being able to actually regain that participation in a social life, I think was really, really gratifying to Sue. So, so we know that all of this makes such a difference. All right, this is a little model that we have that talks about really how a community health worker is integrated into that healthcare model. So I'm gonna, on the next page, talk about some of the settings that we've had community health workers in, but this, if you've been in a clinic setting, this will be a familiar model to you. So often we're gonna get the licensed social worker who is working with some of the acute needs of maybe the patient. We have a care coordination nurse. She also might be doing some of that more intense case management with people. They might be a little higher risk. And we have our community health workers as another member of that team, who's the connector, the facilitator, working on self-management skills. It's going to have a little bit longer term relationship, doing things like closing those social determinants of health gaps, connecting with services, doing systems navigation, and bridging sort of those internal and external care team needs. So we definitely have learned along the way about how integrating in clinic settings we've just seen what happens when that's successful. Right. This is talking about the roles that our community health workers have had internally here at Juniper. We've met with patients in clinics after they've met with clinicians. We have some pilot projects where we've had clinicians refer into our evidence-based programming. We are working with patients at Sanford. We had a population that was presenting with several chronic health conditions. So we were there to try and facilitate some chronic disease self-management and falls prevention workshops. We have worked with some participants in our falls prevention classes to afterwards do social determinants of health screens. We know that there are lots of links between somebody who may have those social determinants of health needs and fall risk. And so it's been fun. We do have some researchers who work on looking at data for us who have seen some interesting connections there. We're closing loops on those social determinants of health gaps, assisting with systems navigation. We've also been housed in some senior residential facilities where we've done a combination of integrating into the community and doing social determinants of health screening, and also doing some of our evidence-based classes, and really trying to do some of that navigation that happens. That it is hard for all of us, but especially in this day and age with, if you might not have technology skills, and that might be a barrier, and having somebody who can help you through some of that is really helpful. And then, of course, facilitating those self-management skills. Our referral process, and this can work for anybody actually. We generally have our referral come in. I'll show you in a minute what our portal looks like with your referrals at yourjuniper.org. We have our wellness engagement specialists. When those referrals come in, they reach out to find which classes might work best for people. And then our class leaders will support people through the program. And then we can follow up with our referrer to make sure that we've kind of closed the loop there. We do have an online system, so there are a couple of ways as a community health worker you can find classes that might help for people. You can go to yourjuniper.org, and I'll show you that on the last page. We have a web portal for finding and registering for classes. And then we also have that online referral system right there. So, so you can just fill this form out. You can click on that referral form and send one on over to us. Oops. All right. So I'm going to tell you just a couple of other stories, and we'll kind of sum up here. So one of the really beautiful things that we have noticed from these classes is that people get really, and it's a good relationship builder for those class leaders. We know that people start to look at those class leaders as a trusted source of information. I have a really great story about somebody who teaches our classes through a hospital, and she had a couple of women who were friends who came in, and they took all of her evidence-based classes, and they loved her so much as a leader. They said, okay, what else can we take from you? And she said, well, I suppose you could take my Stop the Bleed class. So they said, okay, we're going to take it. So they took her Stop the Bleed class, and then they said, okay, what else do you train? And she said, well, I teach car seat safety. I don't know if that's going to be appropriate, but you can take car seat safety if you want. And they said, oh, well, we'll ask our daughter-in-laws if they think that would be helpful for us to know. So I know that part of that becoming a trusted community health worker and a trusted person for health information, this I think is one way that we can do that through these evidence-based classes. I do feel very, very grateful to be working at this edge of where social and healthcare intersect. I think that the community care hubs, as we've talked about, they really can help with equity. They can get services in the areas where participants are. We know that our community-based providers are the ones that know communities the best, and so they can help with that. We always call it that translation with the community where the program is going to be held. We also know that this model, this community care hub model, can be a really effective way of addressing social determinants of health. So as you think about us, if you think of that model where we're helping our community-based organizations get funding from health plans, and we are doing, I always say it's the non-glamorous part of the work, but we're out there talking with the health plans. We're doing marketing and learning how to talk kind of healthcareese to the health plans. We're doing the contract piece of it. We're doing a lot of the compliance piece and assisting our community-based organizations to make sure that they have the compliance there to actually be, when you're offering a Juniper program, you actually are offering a health service. So making sure that you're doing everything you need to do to protect people's health information. We sort of take on a large role of that sort of for the community-based providers. So, so it is a really innovative model to then be able to pass some of those healthcare dollars to people who are affecting health through those social determinants of health in a lot of ways. So, so that's why at the beginning of the program, I said, don't just think of us as evidence-based programs, even though we do that. There's potential for this model, and you'll definitely see us growing and expanding in the years to come. So I'm gonna stop my screen share and see if anybody I see we have a couple of new people. Is anybody on that has any questions for me?
And can I just interject just a little bit? If you're on and you joined us after the presentation started, could you please, if you feel comfortable enough, come off camera and introduce yourself and give us your full name, your title, your location in the Twin Cities, and your connection to either the CHW workforce, or what do you love about being a CHW? Okay, everyone switched. I saw Miss Peggy. Hi, Miss Peggy.
Hey, trying to get my laptop open.
There we go.
Hello, everyone. Thank you very much for that presentation, Stacy. I am with North Point Health and Wellness. I am a
community health worker program coordinator. I really enjoy my job because I'm in the community and I'm actually navigating services, regardless of what it is, whether I have the services there at North Point or if someone else, like listening to this, you know, if there's something we don't do, I'm always looking for the different areas where we can assist, because it's all about meeting those needs. So whenever I'm meeting with even new clients or patients when they come through the door, if North Point don't offer it, we're gonna figure something out, you know. And I'm so thankful for the partnerships, because I can do that because we have partnerships, right? So I really love that, and being able to help educate and learn as well, as we continue this journey. And I remember working with it wasn't Juniper then, but it was the Living Well program, chronic. I actually did that training at one point when I first started North Point, and I think it was 6 or 8 weeks. And I remember that even the diabetes class, and a lot of the seniors still ask about that, far as getting in and getting more information, because they learned so much. So I'm just really happy for what we have, all of us as partners have to offer.
Absolutely. Well, that's good. And we can make connections. Stacy, meet Miss Peggy Moore. Miss Peggy meet Stacy. I'm a connector. I'm doing what CHWs do.
You are a connector.
I have a fond connection with Trellis and the Juniper team. I had the honor and privilege to be amongst the esteemed colleagues there for almost 2 years as a CHW, working along my colleagues. And so it's just really interesting, because I left at the cusp of the conversation around community care hubs, to assume my position here at the Alliance full time. And programs such as those by Juniper and the community health workers that are providing these valuable services offer so much benefit. I was initially introduced to Juniper as a recipient, a client. I had sustained a spinal injury in December of 2022. And so during my rehabilitation process through the pain clinic, I was introduced to their classes, and I took a matter of balance in a couple of them because I was at risk of falling because I was trying to regain my mobility. And then connecting with the Alliance, doing work and volunteer work, I was introduced to Juniper again because they were hiring on a CHW. And I think Sue Yang was a little bit ahead of me because he was transitioning over as a community engagement specialist. And so they were merging those programs. So I came at a really dynamic time as the program was growing. And then they added a third CHW on to the team. So I was assigned to some of those early on buildings. So it brings significance. So I understand that grassroots level of that program development. And so I see the enriching services that the CHWs are bringing to the Juniper network. Accessibility, they're proving access to healthcare for those within the network, the holistic approach of just the nature of a CHW, and the preventative care, that educational and health promotional piece. It's cost effective, as we all know. We know our ROA for CHWs. I'm very proud to proclaim that. And then just the empowerment, like you shared those stories. I have valuable stories that I have when I was on the Juniper team, or just being a CHW, of effective care when individuals are getting their needs met, in a holistic, whole person-centered approach. And this just that health equity piece. So overall, community care hubs, I'm learning, and CHWs are playing a pivotal role in this leading work, in improving health outcomes, enhancing community engagement and healthcare, and promoting a more equitable distribution of these health services. So thank you, Stacy, and thank you to the Juniper and Trellis team for sharing what you guys are, what your impact is that you're doing across the state of Minnesota and your utilizations of CHWs. I thank you all for being here. You guys just asked away, please, and be intrigued. We're in an intimate setting. Ask questions of, how CHWs can continue to fit in this conversation with Juniper and as well as Trellis.
Stacy, I have a question. So do you have social workers and care coordinators, case managers on your team at Juniper as well? Or was that connecting with outside staff for that help?
Are you kind of referring to that slide that had so that,
Yeah.
that's a really good question. So we know we might have our community health workers in a clinic settings. For example, we were in Sanford and Worthington for a project. And so that then we would be integrated within that system. Mhm.
Okay, that explains that. Thank you.
What would a program like Juniper, I know Miss Peggy was saying that you're very familiar with the programming early on. You have the historical connection to the Juniper program. Are any of the CHWs trained to be deliverers of that service, or you guys would be it would be something that you would have to reconnect and figure out what that relationship would look like?
We would definitely have to reconnect. It has been many years, and I don't know if you remember Angela, Don Fargus.
Oh, yes. He took the program with me. He was one of my
Yes. And he's the one that brought it in, even with the diabetes prevention program as well. And so that was part of his thing. He wanted to make sure that the CHWs were educated enough to share and help the community. So we took on those different projects at that time. But so much has changed, and people have come and go. So we don't anymore. But that's something that we need to seriously think about, how we can engage more, because as Angela, and we'll be talking more about the certification of our CHWs, and making sure that they're internships and that we're educating them, and it's ongoing education, and really getting them into that role and feeling really empowered and good, just comfortable in that setting. And that's something we need to work more on. So much has changed, but we need to get back to those roots. So definitely, Stacy or whoever, we need to figure out how we can continue to educate and all of us be engaged to help and assist. Yes.
Absolutely.
Yeah, we're definitely available to chat and just talk about what might, how that might fit with being able to get some health plan reimbursement too. Mm-hmm.
Awesome. Because we're with the clinic, so we're trying to figure all that out now that we're not separated, because we were like human services as a human as just a resource area. But that's no more. We're with the clinic, we're as a whole. So I'm sure there's a lot more that we can look into and have conversations about. So I'm looking forward to just learning and growing and moving in the direction of continuing to assist and help. So yeah.
Absolutely. I just love this, making connections and building relationships.
So fun.
That's so beneficial, for a systematic approach as well as an individual or community capacity building approach. We have to, we're often siloed and we don't communicate. And so we don't know what's out there. But when we start to connect, we can start to bring those collaborative forces forward and working, because we're all working towards the same cause, better health.
Yeah.
equitable approaches. And so, and we're doing that through the CHW model. So, which is unique. So it also brings awareness to the CHW workforce, and it adds on to the workforce development, you know. And to tag off of what Miss Peggy was speaking about and alluding to, the Minnesota Community Health Worker Alliance was awarded the HRSA federal grant to provide 90 scholarships a semester until September of 2025. And to build and diversify the public health workforce utilizing CHWs as a strategy to health. And so we're graduating cohorts. We have a summer cohort going, and our applications for fall 2024 has opened. It opened on May 1st. And so we're taking applications. We're prioritizing those applications that we get by July 17th. And then we've already started distributing award letters for those that were in the first sector of applications coming in. So we'll continue to take those applications until July 31st. The application window will be open. So if you know of anyone that would like to take a opportunity to become a CHW, please share our website information. They can actually fill out the application and everything on the website. It comes to our database and then it's sorted, and our application committee are independent individuals that review the applications, and then we do the reward awarding process. So I am the student support coordinator on that team, and so I am tasked with assisting applicants through the application process and students through the student experience. And then a warm handoff to Vanya Howard. She is our field experience apprenticeship coordinator, and so she helps organizations and CHWs establish an apprenticeship program. So she's an expert at her site. And then we have Rachel Stoll, which is our program manager. She kind of works behind the scenes, helping us with logisticals and the format as we roll out the grant. So it's an exciting opportunity. We try to provide the students with the best experience possible. We have a partnership with all of the accredited facilities across Minnesota. And so we meet with them regularly on our education committee. We're constantly auditing and reviewing our curriculum, which the Alliance is the creator and owners of that. Our curriculum is implemented in 23 states and one pending as of yet. So we provide technical support to individuals that purchase our curriculum. And so, yeah, it's really excited to see how this how everything rolled out. And actually we graduated our second cohort of CHW, so I'm really proud about that. Some of them come to the Alliance as interns, so we are looking for intern sites, and we are looking for apprenticeship sites. You will not be alone. The Alliance can help you walk through that process. We have experts at every level of that dynamics. Yes, Gary.
I don't use Zoom very often. I was trying to
Oh, no
clap my
worries.
hands. I was trying to raise it.
I seen some hands. I seen the hands.
I seen the hand.
But yeah, Angela, that is just amazing. We have already two students, or even we're even having like even the guests that come through the community that are looking. We have a new person that is career development, right? And so the CHW Alliance, or that program, is one of the things that we're offering to those who are looking for a career change into what's so they're applying at the different colleges, or figuring out what works for them out of the 5 that you have there. So I'm really excited about what's coming next. And so Stacy, I will be reaching out to you. We got to get these CHW certificates.
And the unique thing about it is the CHW, once they're done with their with their training, they can do the internship in place, or they can do it in lieu of the apprenticeships. And so there's a stipend for the apprenticeships. And
Yes.
so it's to help with sustainability. So that's the unique part. If you already have an individual that, or you have someone that's interested in and becoming a CHW, and then we work with you to show you how to support that individual as they obtain their certificate, but then you get a whole year of technical support and support from Vanyi to help make that position sustainable. Because if you look at it, we're cranking out 200 and 90 students a year, and so we need jobs, we need
Oh, yes,
sites, we
yes,
need
yes.
apprenticeship sites to
Okay.
keep growing. When we first, now I think we're up. I haven't looked at the numbers as of far, but we're in the 20s as far as our apprenticeship sites, because it's not as daunting as you think. And it's not as scary as you think. And so Vanyi can walk you through those processes. So there's someone here to help you through that. So just spread the word about that. If you have any questions, feel free to reach out to myself and I can connect you to our Rachel Stoll, which is our manager, if it's around finances, tuition, or anything like that. Myself around the application or the student experience, and then Bonnie Howard to learn a little bit more about the field experience and apprenticeship process. Feel free to just reach out to us and just have a conversation so you get a better understanding of that. Do we have any more scholarship questions? We could switch on to our next CHW Learning Circle will be August 7th, and it will be the Kidney Foundation around kidney health. And so we'll have presenters from the Kidney Foundation presenting around kidney health, chronic kidney disease, and other subsequent trainings that CHWs can have the opportunity to train through those programs, as well as I'm excited we're going to be having a guest speaker. He is a kidney a patient, a chronic condition kidney patient advocate, but he's also a kidney transplant recipient. I've met with this young man and he has a phenomenal story. And so he's going to join the presentation and bring his life experiences. So I'm excited about that at our next circle. We also have coming up this Saturday, July 13th, CHW training sponsored by the College of Rheumatology, and it is a lupus training. And so it's an intensive in-depth training. There's 6 modules to the training. We did our in-person training on a Saturday and it was an all-day training. And so we did our virtual training, but we're breaking it up in cohorts. So this our first session will be this coming Saturday, and we will roll out the first portion of the training, and then we'll schedule the subsequent online training. CHWs will get a certificate. They will get a certificate of completion. And also at the end of the training, we have unique placement we have potentially unique placement for CHWs because we have a list of rheumatologists across the Twin Cities that are interested in the CHW care model. And so in those spaces, in those clinical care spaces, oftentimes CHWs titles are not community health workers. And so we have that language for those CHWs that are interested in being trained in lupus. And so we've had pretty much success. The College of Rheumatology, along with CHWs, created this training. And so it's CHW focus, it's CHW led. And so they're piloting across the 50 states to see the receptiveness of CHWs and the feedback. So if you would like to be a part of that, I will send out today. I'm going to do it today, so I don't forget about it. I will send out the flyer for that. It's a simple, you can register through a QR code. There is a pre and a post test obligation to that because we want to gauge what CHWs know and what they have learned from this set training. And so it's a wonderful opportunity. It's a very enriched training, and we have handouts in, I want to say, about 8 to 10 alternative languages. So that's the excited part about that. Nurse Keisha Heslett with Nurse Excellence Healthcare is the one that is the leader of this training, and I will be one of the co-facilitators on that training team. So if you need, I will follow up with that information. And I see something in the chat. Let me scroll a little bit. I don't have my glasses on. And as any glass wearer would know, you never know where your glasses is when you really truly
Oh,
need
I was just saying that a few of my CHWs, including myself, could use a refresher in some of the classes. I'm not sure which, but it sounds like maybe Peggy had some people that maybe could use a refresher. And so I don't know, we can talk, Stacy.
Mhm.
Let's just talk.
Absolutely. Oh yeah, I see it. Yep, absolutely. Just making those connections. So, stay tuned for more. And Stacey and I will talk, we'll talk after, to see what, information you need, you guys that have attended may want or need from this presentation. Thank you so, Stacey, so much, for this informative, session. Also taking me down memory lane. I appreciate that process. It was good to connect with everyone. In parting, we do have the Rural CHW Conference next week in Worthington, Minnesota. And Roxanne is the coordinator and leader of that conference. And so I'm excited about that. It'll be from July 18th at 3 p.m. till July 19th at 1 p.m. So it will be at North West Tech College. So I'm excited about that. If anyone on the call would like to know any information about that, please reach out to me. And I will provide you with the lodging information and all of the scheduling and everything around that. So feel free to send me an email if you would like more information. I have to check because they were providing scholarships through we had an abundant outpour of sponsorship. So we were providing scholarships for CHWs and CHW students. So I will have you heard any updates, Carrie? Because she's a part of the planning committee. So
Oh, I haven't.
we meet tomorrow, so I will definitely know more information about that and see if there are any scholarship funding available. So if there are any scholarship funding available, if anyone interested on the call, let me know, and then I'll just send you the link to fill out that that form. I'll make sure that it hasn't closed out. I think that's all of the announcements on the Alliance behalf. If you on the call and you want to join in your CHW, you have to be a CHW. You want to join the lupus training on Saturday, I'll send up follow information out about that. If you're interested in or share that information with any CHWs on your team, to take advantage of that training. If you would like more information about the conference, let me know and I'll send that out to you. Yep, I'll send it. I got your I send it out. Can you put your email in the chat? And then I'll make sure that I get everything out there and follow up. So thank you everyone for joining us today and sharing this space with us. So have a good rest of your day. Bye.
Bye-bye.
Hi, everyone.
Thanks for everything. I'll be in touch, Stacey.
I look forward.
Okay.
Okay, now I'm gonna, okay, I gotta stop.
Thank you.